Hey everybody, Dr. King here with All-Star Veterinary Clinic and another episode of Dr. King Says. In today's episode, we're going to teach you how to clean ears properly. I've got my guinea pig Wade, who actually is one of the recipients of the foundation, and Cindy Mather, our veterinary assistant. So without further ado, let's get started. All right everybody, before you get started, make sure you have all your supplies ready, because sometimes your pet won't cooperate. So you want to use either gauze pads to wipe out the ear after you put the cleaning solution in. You can also use cotton balls to wipe out the debris. Q-tips are acceptable, and the reason why is because the ear canal for a dog is really long. And so you're really not going to hit the eardrum as long as you keep your finger at the end of the Q-tip. Of course, you need the cleaning solution that's either been prescribed by your veterinarian or a general cleaning solution to clean the ears. And if your pet has an ear infection, then your medication. So to get started, we usually have somebody helping us and we put the pet in a sitting or standing position. I always typically hold the collar of the pet and the ear flap of the ear that I'm cleaning. And that allows me to have control over the head and keeps the pet from shaking their head. If I have control over his ear or I'm holding his ear, he will not shake his head while I'm holding it. Next, you want to grab your cleaning solution, and when you introduce the cleaning solution into the ear canal, you are going to put as much cleaning solution as that ear canal will hold. You're not going to hurt the pet. You might waste a little bit of product, but you want to really make sure you put enough cleaning solution in there. All right, Wade.
Come on, Wade.
So I'm going to hold, again, I'm going to hold the collar. I'm going to hold the ear flap. I'm going to turn my bottle of cleaning solution upside down. I'm going to bury the nozzle all the way in the ear and squeeze the bottle until I start seeing the solution come out of the ear. Once I've done that, I hold the tip of the ear and I rub the base of the ear to get that solution really squishing around in there and dislodging a lot of the debris. If you let go of this ear flap, he's gonna shake his head. So a lot of times you wanna move out of the way if you've got an ear that has a lot of debris in it. Make sure you do this outside in your garage, not in your kitchen or where you have a white room. All right, and then we will we'll let go. See if he shakes his head. He may not, because there we go. And then I'll use my wiping materials, whether it's gauze or cotton balls, Q-tips, to wipe out the debris. I typically will flush the ear twice in an effort to try and dislodge as much debris as possible. Now that we've cleaned the ear, we're going to medicate the ear. So medication's used if your pet has an ear infection. And it's really important to clean the ear prior to medicating because the medication sits on the surface of the debris then and really will make your pet feel better but not resolve the problem. And we have several reasons why ear infections come back, and some of those involve not medicating well enough, not cleaning the ear prior to medication, and then not using enough medication when we're treating. So, all right, Wade, step a little bit closer here. When we medicate an ear, we always use ear medications prescribed by the veterinarian. Most of these ear medications, if not all of them, are gonna have an application tip on them. They are designed to be buried inside the ear canal. And here at All-Star Veterinary Clinic, we dispense medication in the ear canal. We don't count drops. We actually do enough medication until we see it coming back up out of the ear canal. That way we know that we have enough medication in that ear canal. As I mentioned earlier, those ear canals are really long, they're L-shaped, and we need to make sure that enough medication gets all the way down to that horizontal canal. So again, I will hold the collar and I will hold his ear flap so that he cannot shake his head when I'm putting the medication in his ear. You will bury the medication all the way down into the ear, or the application tip all the way down into the ear. Squeeze the bottle until you see medication coming back up out of the ear. Put your bottle down. Don't let go of the ear flap because you'll shake it before you're ready. Rub the base of the ear to squish that medication around in there. When you're done, we will let go of the collar and the ear. And he's distracted by another dog.
Yes.
A lot of times they'll shake their head when you're finished. And if you have any excess medication on the ear flap, you can wipe it away with your gauze pad or your cotton ball. Thanks for watching this episode of Dr. King Says. If you enjoyed this video, make sure you leave a like below and follow us on Facebook and YouTube. We'll see you next time on Dr. King Says.